Today's topic: are you planning to get pregnant and you had an ectopic pregnancy before and you're wondering if you're able to conceive with just one tube? These are some questions which some people asked me on the channel on the video I made one time on an ectopic pregnancy. I had this same problem, but since then, no period. Please help me. Now another one has asked again another question saying, people say that if you have a right tube removed after an ectopic pregnancy, you have less chances of conceiving as compared to the left tube. Is there anyone able to conceive with the left? This is what we're going to be talking about on this episode today. There are two things here: whether it's possible to conceive with the left if you have removed the right tube, and secondly, if they remove your tubes, your menses cease because they have removed your tube. This is Talk Pregnancy with Dr. Noella, and here we tell you all about pregnancy and other women related health issues. Please, if these are the kind of content you like to watch, then don't forget to click on that subscription button so that you get weekly videos on pregnancy and women health issues. So click on that subscription button now. Let's go. I'm going to just explain to you simply what ectopic pregnancy is all about. I still bring my chart. I love this chart so much, and because it describes everything. This is the womb. This is the vagina. This is the womb. This is where the sperm, comes in and gets inside here. And then this is the ovaries where the eggs are being found. This is the egg coming out here with ovulation. It ovulates and it gets inside here. And then the eggs which has been ovulated, this thing is like a cup. It can just help, like a broom which can help and pick up the ovaries at this place. Once it picks it up, it goes in. If this sperm comes in and fertilizes, this is where fertilization occurs, usually around this middle part. And the fertilized egg comes in and sits inside here. This is implantation, where the fertilized egg has implanted. Now what happens is, with ectopic pregnancy, so it can occur either in this side or this side. Therefore, if this thing is removed, if one of the fallopian tube, let's say the left, is removed, definitely fertilization can occur on the right. So the fact that your left tubes are removed, the right too can do the same thing. So there is no problem having just one tube and having the tube which is on the right side. It can still get pregnant, and we have seen many women who have gotten pregnant with one tube, and maybe it's even only the right as well. An ectopic pregnancy can occur in any side. What is the most common cause of ectopic pregnancy? Is sexually transmitted infections, chlamydia, gonorrhea, because once they enter, they come in and just come and settle at the level of the tubes, and they cause like a wound and a scar there blocking the tubes. If you see very well, the tubes are very tiny. So if there's any scar, it can just contract and close that place, making it difficult. If fertilization occurred here, for it to come here, it will block here because it's big and it cannot pass in that tiny place. Sperms definitely can pass because it swims and pass anywhere, but once it's fertilized now, it cannot pass there, and it forms an ectopic pregnancy at that point. Therefore, it's important to know that if any of the tubes are removed, any of the tubes can still get pregnant for you, and it still comes. If the tubes are patent, if the tubes are passing very well, then it's going to pass and it comes and implant here. So be it the right or the left, you can still get pregnant with that. Will your menses cease? Definitely not. I did a detailed description of the menstrual cycle. Please, after this, click on this link and you go and watch. These are the ovaries here. There are hormones which are being produced at the level of the brain, and it stimulates the ovaries to produce eggs. In the process called ovulation, the ovulation, it comes here and ovulates, and it remains in the fallopian tube. While the egg is at the level of the fallopian tube, the inner lining of the womb starts getting thicker. So it starts increasing in size like this. It becomes thicker here. And once fertilization does not occur here, the egg dies. And this inner lining here, which has been thickened, sheds out now as your blood, as your menses. So even if you had an ectopic pregnancy, the ovaries are still there functioning. The ovaries, they're still going to be ovulation. Your hormones are still working. So you still have your menses, please. So if you're not seeing your menses and you've had an ectopic pregnancy before, then you have to check, because there are other causes. Even the sexually transmitted infections can lead to absence of menses. It can lead to delay in your period. So if you're not seeing your period, there might be other causes, but not from the ectopic pregnancy. I hope this was helpful. So if you had an ectopic pregnancy before, you need to follow up closely. They have to check whether the other tubes are passing as well, so that if it's passing, then they can follow you up closely and mark you. Please take this, pay attention to this. Once you discover that you are pregnant, as you miss your period, go immediately to the hospital, because if you had an ectopic pregnancy on the left side, there is a higher chance of you having it on the other side. So you have to check as early as possible, so that it should not grow bigger and burst this fallopian tube. And once it bursts, you need the minutes to be safe, because if it bursts, there's heavy bleeding. That's what they call like internal bleeding. And once you have internal bleeding, to save you is a matter of minutes, and you need to have the right technical platform and wherever you are. So if you are pregnant when you had an ectopic pregnancy before, please go and do an ultrasound immediately, so that you identify where the baby is, so that if it's still another ectopic pregnancy, because you know that once you have an ectopic pregnancy, you have a higher chance of having another ectopic pregnancy as well. If it's another ectopic pregnancy, they can manage it early without any surgery, and maybe without removing your tubes. And also, if you have it, if you take it early, they might manage it early. But if it's still now inside the womb, then you can follow up your pregnancy normally. Therefore, ectopic pregnancy, if you have one tube, you can get pregnant with the other one. And ectopic pregnancy does not lead to absence of menses. There might be other causes. If you want to have a private consultation with me, please click on the link below and you can reach to me. We discuss one-on-one, and we actually follow up with you and see your own plan of action, so we can follow you up throughout maybe the preconception period where you're preparing for your pregnancy, and see when you get pregnant, then we identify where the baby is sitting. So if this was helpful, don't forget to click on the link, subscribe to this channel, share it to other women out there, and give a thumbs up to our videos as well. Don't forget to subscribe. God bless you. Bye.